And now you've talked, I think we've mentioned clean cooking so many times. And for a viewer who is watching us, would like to understand why clean cooking? Why clean cooking?
It's a good question, because why clean cooking? Let's start it from the basic understanding, or from the basic setup of our home. Every day people have to cook, every day people have to eat. So why clean cooking? Because it really plays a big role in terms of issues surrounding the cooking itself, and even how you are able to acquire these devices, and also having to play around with the adverse effects of the traditional cooking as you compare it to the newer or cleaner or even modern cooking. So why clean cooking? Because it cuts across so many things. We are talking about issues to do with health. We are talking about issues to do with the environment. We are also talking about issues to do with socioeconomic impacts, because there are people who are also doing business around that. There are societal issues.
Maybe before we go there, you can touch in details and tell us how cooking affects health. For example, if we do not transit to clean cooking, how it's affecting health. You can give even data that we have, how it's indoor pollution, it's causing how many deaths every year in Kenya, in Africa, and even globally. So that we can be able to see the impact and therefore have that motivation to transit to clean cooking.
Good. When we are looking at issues to do with clean cooking, and even if you look at the global level coming down to the local level, if you're talking about the global figures, it's about 2.8 billion people who are still using inefficient cooking methods, or even rudimentary ones. 2.8
billion.
Yes. If we are talking about in the African setup, sub-Saharan Africa, we are talking about more than 650 million people still using. And within our Kenyan context, I think our population is about 50 million people. And between 70 and 80% of these people are using traditional cooking methods. So you see, this is a very big, staggering figure, and we have to tie this with the ambition of the government by 2028 to have transitioned these people to modern clean cooking solutions. So it's an issue that needs to be looked at seriously, because there are very adverse effects when it comes to health. Like, for example, when you look at the deaths, more than 25,000 people dying every year because of indoor air pollution. You see, it's a staggering figure. This includes women, this includes children under 5 years, because as the kid is there, the mom is there, he or she is inhaling these fumes that come from these rudimentary technologies. So when you're looking at this, it's very imperative for us to transition from that to modern to clean solutions.
Can you relate this to the health burden of households, in households rather?
It's basically the smoke that comes out of the energy source that you're using. So, like, for example, a lot of people use the three stone fireplace. So these fumes that come out of that place, one of it is the particulate matter. We are talking about carbon dioxide, we are talking about carbon monoxide, and these are things that people are inhaling, and there's data that compares that to it's more than people who smoke cigarettes. So it's really detrimental to the respiratory systems, issues to do, any issue to do with respiratory system, be it cancer, be it issues to do with lungs, be it pneumonia, because pneumonia is the biggest killer when it comes now to children under the age of 5 years, because the lungs are not well developed, and they're inhaling these fumes. So it also in turns make it an economic burden, because if that continues, then still continues with the burden, and people are not even able to really move. And even if you look at another angle in terms of health, is where people go for long distances to look for these firewood or these energy sources, because probably they are not available within the locality. So it's a big burden when it comes to that, and then there are issues to do with costing. Still, people, when you do that, and the health data from KNH or from the Kenya National Bureau of Statistics, it's a very big burden that also the government also has to incur, because now this has to continue. But if we were to transition these people, you see now the opportunity cost, now they are able to really recover from that. Yeah.